Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, October 4th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, some of you may know that this is the second update we've sent out this week. On Wednesday, an email blast went out to all members with an update in regard to the Social Security windfall elimination provision, government pension offset, where things stand in Washington, D.C. with moving legislation forward. If you have not yet read Wednesday's update, please look for it on massretirees.com or look in your email. And if you're watching this video through today's email blast, a link is contained in the email to that specific article. Now, in this update, we're going to focus on really three different things. One being our upcoming area meetings in Pittsfield and in West Springfield this coming week. We're also going to talk a lot about retiree health insurance. Finally, we're going to talk about the second phase of our annual PAC drive, which just began earlier this week. But let me jump right into it in terms of retiree health insurance. Those of you who have been members of Mass Retirees for some time know that as the years have gone on, we have focused on and dedicated more and more of our time, energy, resources into issues related to retiree health insurance. As important as your pension is in working on things like increasing COLA benefits or fixing the situation nationally with weapon GPO, your health insurance benefits, the plan design, the cost, both in terms of your monthly premiums and out-of-pocket costs, and the overall quality of your benefits are also extremely important. And due to the complications that have only increased over time when it comes to healthcare and health insurance, and the extremely high cost of these benefits, more and more pressure is being put not only on you, not only on cities and towns and taxpayers and everybody else in terms of paying for these benefits, but the overall system as a whole. Now, this past week on Tuesday, Blue Cross and Blue Shield of Massachusetts hosted the second annual Municipal Health Insurance Summit. And I want to take a moment just to thank our good friends at Blue Cross and Blue Shield of Massachusetts for continuing to step up, continuing to help lead the way in terms of supporting both public retirees and active employees with just things like the Health Insurance Summit. Without the support of Blue Cross, the summit wouldn't have been possible. And working directly with Blue Cross on this project, I know firsthand the amount of time, energy, effort, money goes into supporting these types of activities. Blue Cross and Mass Retirees have had a very close friendship and working relationship going back more than 40 years. So this is a long-standing working relationship that exists between our association and the Blues, and a similar relationship exists at the state level between us and the Group Insurance Commission and WellPoint, formerly Unicare. So whether you are a state retiree or a local retiree insured through the GIC, or a local retiree insured through a city or town or district insurance plan, we're working on behalf of your best interest across the board, regardless of where you're retired from or regardless of which health insurance plan you happen to be enrolled in. Now, the focus of Tuesday's summit was really on three different aspects of municipal health insurance. One being the joint purchasing arrangements that exist across Massachusetts, the second being the bargaining process that exists at the local level, and the third being the relationship between insurance brokers and consultants at the local level and the differences between brokers and consultants and the different roles that they play. Now, at the local level, health insurance is still bargained, and there are various ways in which insurance is bargained. One is under 150E, which is the old collective bargaining arrangement where local unions would bargain on behalf of their local members for health insurance. Retirees, unfortunately, are not included in the 150E bargaining process. As a retiree, you do not have collective bargaining rights. The newer way, and the way that is more commonly used at this point in time, is what's known as coalition bargaining, or so-called Section 19 agreements. And that gives retirees, along with the active employees, the ability to negotiate health insurance benefits together through a coalition. And our association has the legal responsibility under the state law to appoint the local retiree to these bargaining committees, which are known as Public Employee Committees, or PECs. At the local level, there's also something known as an Insurance Advisory Committee, or an IAC. However, the IAC does not bargain or negotiate health insurance benefits. They play more of an advisory role, as the name says. However, it gets complicated because in many cases, the same individuals that are serving on an IAC are the same folks that would serve on a PEC, with one exception. Under a PEC arrangement, it is our association that appoints a local retiree to represent their fellow local retirees, independently of the municipal government. Under the IAC setup, it is the local government. So whether it's the mayor, the town manager, the board of selectmen, they appoint the retiree representative to the IAC. And that individual may or may not be someone who is going to represent the best interests of their fellow retirees. It really varies depending upon the community. But in some cases, we find that the retiree representative on the IAC is really just another representative of the local management or the local officials, which again is not in the best interests of local members. However, the focus of the summit that took place on Tuesday was walking through all the various scenarios. At the end of the day, the goal with these summits, the same last year and again this year and in future summits, will be to make sure that local PEC and IAC representatives, whether they be active employees or the retiree representatives, have all of the knowledge, the facts, the figures, understanding the processes. So when they sit down at the table to represent your interests, they understand how the system works, they understand best practices in terms of negotiating over these types of benefits, and most importantly, they know the types of questions that they should be asking. And in many cases, they'll know the answers to those questions before they even ask it. So again, a major focus was the joint purchasing arrangements. And across Massachusetts, there are more than 10 joint purchasing groups working at the local level, purchasing health insurance collectively for a variety of cities and towns. Some communities, such as the city of Boston, for instance, being the largest municipality in the state, purchase insurance on behalf of themselves, so they're self-insured. But many small towns, smaller cities, collectively purchase insurance together. Some belong to the state's Group Insurance Commission, which I believe insures about 56,000 local retirees and active employees at the present time. The Mass Municipal Association's insurance arm, known as MIA, they run a close second in terms of joint purchasing arrangements. MIA, I believe, represents about 53,000 retirees and active employees, and MIA exclusively offers Blue Cross and Blue Shield plans, and they do an excellent job. The other insurance joint purchasing groups across the state operate more or less on a regional basis. So you have the Mayflower Group on the South Shore that is administered through Plymouth County, and our friend Plymouth County Treasurer Tom O'Brien, for instance, does a great job. Down in Cape Cod, you have the Cape Cod Municipal Health Group. They do a great job purchasing insurance. You have the Metro West Group or other various regional groups across the state providing insurance benefits at the local level. And collectively, they do a very good job of providing high quality, affordable, accessible insurance across the board. However, as insurance costs are going up, and as municipal governments in particular are facing more and more budgetary pressures, and as we've reported in recent weeks and months, we've seen across Massachusetts, just in 2024, a growing number of attempts for Proposition 2.5 overrides. And in the majority of communities where Prop 2.5 overrides have come up, they've been defeated by local voters. So it's just showing the types of pressures that are being inflicted at the local level across municipal budgets. And those pressures are only going to increase over time. And at a time when we're seeing healthcare costs going up and up and up once again, And there are various drivers to what is pushing those costs higher. Prescription drugs, utilization, inflation from hospitals and doctors are just causing these costs to go up. It's not the fault of the state, it's not the fault of our insurance companies, it's not the fault of municipal officials, it's the fault of the overall insurance industry as a whole. And while Massachusetts by itself, and certainly Mass Retirees and the PFFM and the teacher unions and the police unions and collectively everyone that we're working with on these issues, we're all concerned about this, but individually we do not have the power to stop these costs from going up. What we can do, however, is try to mitigate this as best as we can and be prepared for the fight that we know is coming down the road, because we know the storm clouds are on the horizon in terms of healthcare, and we know the battles that we have fought in the past. When these issues have risen in the past, there's been a knee-jerk reaction, particularly at the local level, to either cost shift, meaning making retirees and active employees pay more in terms of copayments and deductibles, changing health insurance premium contribution splits to require you to pay more, or degrading the quality of the insurance benefits that you enjoy. We do not want to see either substandard policies being offered, for-profit companies coming into Massachusetts that are not necessarily on par with the types of benefits offered by Massachusetts-based insurers like Blue Cross at the local level, like WellPoint at the state level, Harvard Pilgrim and Tufts, MGB, Neighborhood Health Plan. They are all fantastic plans that we are very fortunate to have here in Massachusetts, and we want to make sure it stays that way. Now, in terms of I'm not going to get too deep into the differences between brokers and consultants. That's more of a local issue, and it's something that our local PEC members have now been educated on and know what types of questions to ask, to know who it is that's representing local governments at the bargaining table and what their intentions may be. And there's a stark difference between a broker and a consultant, including different licensing requirements. So it was very important for us to delve into those types of issues at the local level or through the Healthcare Summit. Now, the last thing I want to say about healthcare before I transition over and end with a quick word about our PAC is that October begins the annual Medicare open enrollment process. Now, why I bring this up is for the simple reason to urge you, please do not drop your state or your local Medicare plan and join one of these individual Medicare Advantage plans that you're seeing advertised either on late night TV or through a direct phone call you may get from one of these companies or a solicitation through the mail. These plans are not the same as what you are currently enrolled in, either through the municipality that you retired from or through the GIC. The plans that are being marketed to you from the private sector are geared towards retirees who do not have access to an employer-sponsored plan. Now, an employer-sponsored plan is the health insurance plan that you receive through the GIC or through the city or town that you're retired from. That's what we're referring to when we talk about an employer-sponsored plan, because your former employer is paying for at least half of the cost of those benefits. And by and large, they are far superior to anything you can purchase individually in the private marketplace. There really is no comparison between the two. But during every open enrollment period, unfortunately, we see some of our members accidentally or mistakenly enroll in these private Medicare Advantage plans, only to find out that they've made a mistake. Now, we can reverse things, we can get you out of that plan, but it takes a lot of work and it takes a lot of time and it's headache and aggravation, and it's a problem you don't need. So please do not enroll in those plans. If you do so, you will lose your GIC or your local health insurance coverage. It will be dropped. You cannot have both. So with that, let me transition into just a quick word about the PAC. Earlier this week, we launched phase 2 of our annual drive for the Public Retirees Political Action Committee, otherwise known as our PAC, our PAC. The purpose of the PAC is to support the political activities of our association here in Massachusetts. Now, what I mean by that is simple. The PAC is a Massachusetts only PAC. We cannot use it at the federal level. That means we do not make contributions to candidates for Congress, the U.S. Senate, the U.S. President. The PAC cannot be used for federal campaigns or purposes at all. It's only for the state and local level here in Massachusetts. And while we do make contributions to candidates for state rep and state senate, other state offices and local offices here in Massachusetts, and those candidates have to meet one very strict criteria, and one criteria only, that they support public retirees. We are not focused on political affiliation or ideology or approach on any issue other than the specific issues that all of our members care about. Your health insurance, your COLA, supporting the defined benefit pension system, things like that. That's all that matters. But most importantly, the PAC also serves to promote the activities and the issues that we're working on. So the COLA and the COLA Commission and what comes of the commission next year. Defending your health insurance benefits at the state and local level is going to be a major focus of the PAC going forward. Now, the PAC letter that was sent out on Wednesday was only mailed to those of you who have not yet donated in 2024. However, if you've already donated and you're inclined to do so again, we encourage you to do so. Every little bit helps, but is not mandatory. Participation in the PAC is strictly voluntary. So whether or not you choose to participate or not, whether you've already given, how much you give, that's up to you. We deeply appreciate the generosity of our members. The PAC mailing that went out in the spring and April, the majority of our members chose to contribute during the first phase of our PAC drive. So we're simply following up as a reminder. If you have not yet given, or if you're inclined to give again, please do so. The link to donate online is contained in today's email message. It can also be found at massretirees.com. Upper right-hand corner, that little green button. Click that. You can make a contribution securely online. Of course, you can always mail in a contribution. That information is contained both on our website as well as within the PAC mailing that you would have just received. So again, thank you so much for your support of our association. It means the world to us. Thank you for tuning in and watching this video. We're going to follow up again next week with further information on some activity we're seeing in terms of healthcare costs going up, some things we're concerned about. There's a lot of moving parts with all of this. So please stay tuned, and we'll be back to you again next Friday with a new update. In the meantime, if you're in Pittsfield or West Springfield next week, please come on by and say hello. On Tuesday, we will be in Pittsfield. On Wednesday, we will be in West Springfield. So come on by and say hello, and we'll talk to you again real soon. Bye-bye, everybody.